Tranexamic acid has an established role in the trauma patient with a high risk of bleeding. Could giving it in the pre-hospital setting improve its effect? We'll find out on this episode of Osler Shortcuts. Several studies, most notably the CRASH-2 study, have shown tranexamic acid can improve bleeding and short-term mortality if given early. However, lingering questions remain. While previous studies have been conducted in low and middle-income countries, could the results be replicated in higher resource systems? Similarly, while giving TXA in hospital has shown promise, would the effect be greater if given pre-hospital? Finally, could the short-term benefits seen in previous studies translate into long-term outcome improvements? The PATCH study sought to answer these questions. Over a 7-year period from 2014 to 2021, 1,310 patients were randomized from 15 pre-hospital emergency services in Australia, New Zealand, and Germany. Patients received either 1 gram of tranexamic acid loading dose or an identical placebo, with a further dose administered over 8 hours. Patients were included if they had severe trauma and a high risk of trauma-induced coagulopathy, as defined by a COAST score of 3 or more. At the conclusion of the trial, there was no difference between the groups in terms of the primary endpoint, a favorable outcome defined as an extended Glasgow outcome score of 5 to 8, measured at 6 months. However, mortality was reduced at 24 hours and 28 days, results that were statistically significant. No other secondary outcome was significant, however. Most importantly, while there were more survivors in the TXA group, around 4 for every 100 patients included, there was no increase in survivors with good neurological outcomes. This raises important ethical questions. Should we use TXA, knowing it will create more survivors, but those survivors will have a poor quality of life? Or should a drug with the proven ability to save lives be given regardless of the eventual outcome? PATCH is an incredible study for many reasons, not the least of which is the conduct of a high-quality randomized blinded controlled trial in a stressful pre-hospital environment. It addresses a very important clinical question and has a strong methodology. However, there are some things to keep in mind. Firstly, there was a significant loss to follow-up of around 13%. While it is hard to believe the researchers could improve on this figure, it does raise questions as to the impact on the result. Similarly, there was substantial protocol violation in the range of 20% of patients. Finally, the definition of an unfavorable outcome is at best subjective. If you like this summary, head on over to Osler and check out the full review. Like all Osler content and features, it's completely free. See you next time on Osler Shortcuts.